I'd love to start with you, Dr. Weber, and really go into your history because you have a diploma in biochemistry, which you said helped lead you towards research and development of new laser technology. And I find that really interesting that biochemistry led you into that. Not many people always correlate lasers with the biochemistry side of it, but can you go into your background and story and exactly how you got into lasers and that related to biochemistry?
Yeah, it's a long story, but I will try to to explain a little bit in short. We
Do your
can
best.
speak an hour about this story, but it's really an amazing story. You know, you're right that I studied biochemistry first and chemistry for 6 years, and later I made my medical studies in a famous Goethe University. So I worked in research in Max Planck Institute for Experimental Medicine. I had a brilliant education in internal medicine in the University of Göttingen. So I'm a traditional, we call it school medical man, you know.
Mm-hmm.
And then some people ask me, how do you come from traditional medicine to something like laser medicine? Huh? Although laser medicine is also traditional medicine. We assume maybe laser is something on the side or complementary, but laser technology, you know, we have everywhere in the world. We use lasers for eye treatment, for beauty, for operation, surgical lasers. That's well known. And we have other kinds of laser. Later we will speak about it. The so-called low power lasers, which we are using for healing purposes of the body. So the effect of lasers is dependent on the power of laser. Now, I can make a laser light so strong that I can cut a finger with this, but I can make it soft so that I stimulate all these metabolic processes in the body and in the cells. Let me switch off my phone here. So yeah, you know, when you're working long time in your clinical practice, and I have my clinical practice already for 33 years after all these studies, you recognize also the limitation of our medicine, you know, especially if you have chronic patients. And, you know, all these old people, they have chronic arthritis, they have chronic heart diabetes and all this problem. They have autoimmune diseases, so pain everywhere in the body, you know. And our medicine has nothing to offer for this, you know. The people come and sitting in front of you, oh, I have pain, my shoulder, my hip is destroyed, my knees, yeah, what do you prescribe? Maybe some diclofenac, where many people die from the side effects. So the idea was then for me to learn a little bit about natural medicine. And fortunately, end of the 19th, I met a physics professor. He was specialist in laser medicine. And at this time, acupuncture treatment was very famous in Europe. And, you know, putting needles in people, but not everybody likes it. So we had the idea to use very focused laser beams, because laser light can penetrate in the body, as like acupuncture needles. So we have set up a first system with 8 lasers. Today we have 12 or even 16 laser devices where we can stimulate many points. And this is something with which I started, and I treated thousands of people with this, with excellent results. And, you know, but we recognize also the limitation, because not all laser beam, especially the short colors like blue or ultraviolet and yellow and green, cannot penetrate well, but they have a huge effect on the body. So we developed the first laser device with which we can bring the laser inside the body. Yeah, we started with so-called intravenous laser and stimulate the blood to get better microcirculation, better oxygen supply. So, which was very successful. And we have thousands of these devices in more than 50 countries in the world already. Yeah, and from this field, we came to the idea to bring lasers by fiber optic needles into joints on the spine for chronic diseases with excellent results. But something I have to say, because with the laser, normally you can heal the tissue, yeah, especially on the cellular level. We stimulate the mitochondria, we have a better metabolism, which works on the whole body, but you can also destroy bad tissue with lasers. We call it photodynamic therapy in cancer therapy. And that's my field where we are working now. So we give different light substances to the patients and give the right laser light to it from outside or interstitially, and can kill cancer cells by oxygen radicals. So yeah, this is in short the history, what is all developed. And we started 20 years ago with red and infrared laser, the only ones what were available. But you know, the body is made from light. Everything what is living on the world, every cell in our body is made from light. So it makes a lot of sense to bring the light into the body, which stimulates then all the cellular functions and can heal the body. It's a right, yeah, anti-aging therapy. So this is, in very short words, something what laser can do.
So many applications. And I really do appreciate your story because it reminds me of my father's, who also has a European background, was in pain medicine for a long time, chief of pain services, and was quite frustrated with the results he was getting with the options he had. And he started studying, I believe at first, it was really pulse electromagnetic field therapy, but moved into low-level laser therapy. And he saw such better results with the lasers. And back then, you're right, it was red lasers mostly, only from the outside. But you saw that application, how well it did. And actually, he learned about a French method called ACMOS, which is a needleless type of acupuncture that also used lasers in specific points to stimulate certain energy points and chakras. So you're just taking that, further really with Weber Medical, which is so fascinating. I can't wait to start talking about how those applications actually can improve health and cause these biochemical reactions. But first, I want to jump over to you, Jennifer, because you have your own story as well. And as I understand, it really starts with your own personal health challenges with Lyme and lupus that led you into this kind of discovery of medical laser technology. So can you share a bit of that in your story and how you got involved with all of this?
Absolutely. And thank you, Casper. It's kind of a long story, so I'll condense it. So we condense it as much as possible to take advantage of the time and explain, because there's so much to explain in this field, as we know.
Sure.
So I got into this, yes, actually, I grew up kind of with the alternative integrative health field around me, but my original area of interest was performance, vocal performance, as a matter of fact, and classical music, which interestingly enough, I was already looking at the science of frequency and sound on the human body and the physics of it. So that kind of bridged into some of the laser physics in a way when I started looking more into it. But I had a family member that actually was very, very sick. And during the time of caretaking a sick parent and going through everywhere of the United States, and being chronic pain was one of the main issues, but also a very serious infection, we had many doors close on us. So it was a constant search of what could be available. And during that time, I found that I myself was also sick. I ended up in a wheelchair at 18 years old, unable to feel my lower extremities due to some compression and inflammation from the neurological Lyme disease. Ended up saying that I had breast cancer, which I think honestly was probably related at 20 years old to the Lyme disease, and then later on diagnosed with lupus. So I kind of sat there and went, what the heck, right? So my passion while taking care of a sick parent was actually looking into nutrition and looking into bridging both traditional and alternative medicine into one and finding what would work for the individual. Because most of what I saw out there in many of our clinics is that we don't integrate things enough and we don't find what works for the individual, even if there's a protocol designed. So I was quite impressed. I actually started working in a laser company out of South Dakota originally. And then through the path of finding different answers, I started working as a medical research assistant and decided to finish a degree in medical research rather than going back to medical school, because I was taking care of a sick parent and sick myself, right? So if I found that, and actually a colleague of mine told me about Weber Medical years ago, and through all the research and working with many different clinics and having the pleasure and honor of working with different scientists, from immunotherapy to stem cell research to laser therapy to pulse magnetic device therapy to hyperbaric and oxygen to, immunopeptide therapy. There were so many different types of scientists and physicians I got to work with. And it was really, to be honest, opened my eyes to a whole other area. And my passion was finding a way to integrate those therapies for the individual and how the science of it worked. I have passion for that. So I had no idea how we do it, but I decided to open a clinic with my partner, and we were successful. And we opened it with the goal of a smaller clinic, as Dr. Weber is as well, focused on research. And a colleague of mine said, you should really check into Weber Medical if you're looking for a laser. So we did, and integrated 2 laser systems into our practice. And we started seeing impressive results. What we were already doing was working, but to a certain level, right? Integrating photodynamic therapy was kind of like adding gasoline to the fire in a good way. It was making things potentiate in a way that we weren't seeing before. And I was so fascinated with the science of photobiomodulation, photosensitizers with laser therapy. And I had done all this work on myself and gotten to a certain level, but I mean, I was dealing with blood clots and not wanting to take medications, so doing things naturally. And the devices from Weber Medical actually cleared a blood clot in my leg in 3 days. It was impressive. So there's many stories like that I can share personally. But my partner and I created this clinic, as well as our other company, for educating and sharing what's available, and then became partners with Weber Medical to continue educating both the layperson as well as the medical professional, and create a team where we can actually work together on the advancements of this. We work with oncology, chronic infection, and it's amazing what we've seen. It really is. We know we don't have all the answers, but it is quite impressive what we've seen so far in the results that we're obtaining. It's a bit mind-boggling, to be honest, and exciting, and it's always changing.
Really exciting. And that story is wonderful because it's one from patient to practitioner, right? From healing to healer in a sense, right? And I hear it so much that once you go through this healing experience and you've really witnessed and gone through chronic conditions and something that is truly debilitating, once you get through onto the other side, you want to help others, and you become this sort of engineer of sorts, trying to figure it out. And it leads you to connecting to people like Dr. Weber and others from around the world to constantly see what is out there and how we can continue to improve and help others like we've helped ourselves. So great story. And I do want to go into some of what the research and science is and focus first on the endo laser, and possibly, because there's so many applications here, intravenous IV laser therapy. So which one of you would like to take that one on the science and basically that application of how you get to intravenous through fiber optics and what that is doing inside the body, not even going so much into the specifics of each color, which I want to do and highlight, but just on those kind of layman terms to get it started. Who'd like to take that one?
Yeah,
well,
I can.
I would say Dr. Weber. Okay. No, I was going to say Dr. Weber. No. He's the master.
No, it doesn't
Dr.
matter,
Weber, we'll assign this one to you then.
Yeah, you know, when we started this laser project, it was already in the year 2003, so about nearly 20 years ago. We had this idea to set up new devices, one for external laser therapy, but especially one for internal. Especially we started with blood irradiation. And, you know, I want to get these devices approved, officially approved, you know, from our government, because there is no device like this on the market, you know, but we had thousands of studies, especially coming from Russia. 1978, the first publication was made in Russia from some 2 doctors, you know, and they reported about red laser treatment of the blood, and they used it first in cardiology. You know, they could show that the infarction, you know, after heart infarction, infarction area getting smaller, less sudden death of the people, less rhythm problems, everything. And this was the first to report, most in cardiology, but they used it also in chronic infections, especially like tuberculosis, something where there were not medication available for this, you know, septic shocks and everything. And later they expanded, you know, the indications to diabetes, especially, what is one of the biggest issues. And there are hundreds of studies, but the problem is nobody can read them because all written in Russian. And fortunately, this time I had a Russian assistant doctor coming from Lithuania, and he translated all these studies. And I said, the results are so fascinating, what they're writing. I want to get this device approved, but is our TÜV Germany like FDA in the US? And of course, they want to have studies and results and everything. So what did I do? I sent this doctor to Moscow, and he came back with a small Russian device with a plastic bag with 1,000 catheters. And then we made our own study first on my own patients. I called my diabetic patients, my liver patients, high blood pressure patients. And then we generated maybe results on some 100 patients. And the results were amazing. We have seen the liver function was improved, diabetes was improved, blood pressure was improved. We could really prove it on the laboratory, and that is just so fascinating because blood irradiation has already a long history. The first one was done in the US, 1927, with the so-called Dr. Knott's device, where they took blood out, irradiated with UV light, and could see that they could improve the immune system and kill viruses, bacteria. So after this, I published the data in Germany, and then really, because the man who made the approval and check of the company, he said, "Naya, you have not so many studies. You refer mostly on the Russian study, but this is so fascinating. I give you the approval." So we could start marketing it, and we sold a lot and got more and more and more results. This is only the history, Let me tell you something. You will ask me or the patient, what is happening when we give light in the bloodstream? First of all, what I told you already, this American doctor, and this has a long tradition, taking blood out in chronic infection, for example, irradiate the blood with the light and give it back to the body. It's a long procedure, and it's time consuming. I did it myself many times. But this is more elegant, we put only a small needle in a vein, put a sterile thin catheter inside and connect it to a laser, and we can then bring all the spectral colors in direct contact with the flowing blood. So what is happening? Let's start with red laser. This has the longest history. Red laser can lead to a better deformability of red blood cells. So they can go better through the small, maybe nearly closed blood vessels. So improves the microcirculation. But the main issue is red laser stimulates the white blood cells. And we have a different white blood cells. We have monocytes and B cells and T cells and everything. So they represent our immune system. So with the red laser, we have a huge immune stimulation. Also infrared, it's very similar. And later, 2 years later, we developed the first green laser. And green laser has an interesting effect. It delivers more oxygen to the hemoglobin. So the hemoglobin can take more oxygen. So improving the microcirculation, the blood flow, and more oxygen is exactly what we need, especially in all these complications of diabetes and heart people. The next step was we developed the blue one. And blue is amazing because blue increases the nitric oxide, and this leads to a huge vasodilatation in the body. And then 2 years ago, we developed the yellow one. What is yellow? It's like the sunshine in the body, In Chinese medicine, it deblocks, all the meridians, so it leads to more happiness and everything. But yellow also has a huge anti-inflammatory on the body. And the last development 1 year ago was ultraviolet light. And now we get back to the American studies. Ultraviolet can kill bacteria and viruses. Even we have the new studies killing COVID-19 with this. We can kill bacteria like Lyme disease, what Jennifer already spoke about it. So these are the general effect of the different lasers, but there is more. There is an effect on the cellular level. I want to say it a little bit easy, we produce our life energy in the cell. We know this. We burn the glucose and then we get the ATP, our life energy. So, when you look a little bit more in detail on this mitochondria, which integrated in the eukaryotic cells maybe a billion years ago. All these different parts in the mitochondria where the energy is produced are so-called chromophores. So they absorb light of the sun spectrum. And if you look on the different complexes, you find exactly the complete sun spectrum. So you can stimulate one complex with red infrared, one with blue, one with green, one with yellow. So we bring exactly this light back in the mitochondria, stimulate the cellular function, and of course the whole body. So this is something in short for intravenous laser therapy. So we have to regard it in general, and we have to look also a little bit more on the cellular level to provide the people with a lot of energy. And it's at the end, it's an anti-aging therapy. Everybody speaks about anti-aging, but there is nothing better than bringing all this light in the body.
Absolutely. And I just gave a talk with an anti-aging specialist, and we were kind of trying to redefine anti-aging. We said it really starts in the inside. Everyone looks on the outside and looks at your skin and anti-aging, but anti-aging is an internal process. And it's a mitochondrial really process if you want to start with the mitochondrial theory of aging even. So it really starts in every single cell. And if you could provide energy, then you can have this natural aging, you could say, or anti-aging effect, regenerative effect. And what provides energy so well? Light. Light is a transmission.
Mitochondria are our energy factories in the cell. And we call them factories of limited lifetime. You know, in the mitochondria, we have a lot of mutations, and mitochondria have own DNA. And so this, after this mutation, the function is going down. And at the end, the mitochondria will die, the cell will die, and we will die. No? So keeping the mitochondria strong, even stimulating the development of new mitochondria, make a delay in the breakdown of the so-called telomeres, you know, which also determine our life expectation. This is all, especially what the blue laser will do. And what you said is right. No? We have to treat the body, of course, from outside to get better skin and everything, but the health has to come from inside.
Yeah. And it's wonderful you've been able to do that and get the lasers actually inside. And I have to say, I've experienced myself, not only does it actually produce these effects and you feel, you know, better afterwards, but it looks really cool. You see the laser going into you and you're like, you feel like Tony Stark, like Iron Man or something.
It's fascinating.
I feel like you're in Star Trek.
Yes, it's so futuristic. So that's amazing. I mean, I know our patients just love it because you're taking something that normally is applied externally and you're allowing that to apply internally. So, you know, Jennifer, I want to turn this over to you because like I said, I experienced it. Many people have experienced it. I'm sure you have experienced the IV laser therapy with endo laser before, but
Anytime.
you know, patients always ask, and it may be, okay, you're sticking a fiber optic into me. There's light, you know, are there downsides or safety precautions or anything you've seen in the research that you've done?
We have never seen in the years of working with Dr. Weber and the team and training other physicians in clinics and doing it in our own practice, everywhere from intravenous applications to direct injection to a tumor area, to injections to a joint, to topical or laser acupoint topical applications. To this date, knock on wood, and honestly, scientifically, I will say we have not seen a negative side effect. We actually did a small study for doing an intravenous IV study during this whole COVID period of time. We started with a group of about 5 to 10 patients with an intravenous IV laser protocol. We did 5 days of intravenous laser, and we started with only 5 people, and then we increased to about 10 or 15. And we're working on getting up to about 50 or 60 to finish off some of the data collection that we need. But we needed some updated information of specific laboratories before and specific laboratory testing after the receipt of laser therapy, right? So we did these 5 days, consecutive days of IV laser. We did every color spectrum that we have available. We did red, green, yellow, blue, and ultraviolet. The only one we did not do in this specific case was the intravenous infrared. And it was really impressive. We chose people who were not particularly sick, no one that had any specific disease or ailment, just people that every day feel kind of low energy. They really don't have a specific diagnosis, not high or low blood pressure. They're just, don't feel great, but they're not particularly dealing with anything. And after those 5 days, we wanted to see how long the benefits would last, if there were benefits that showed, and also how long the laboratories would actually show those changes. And this is where, honestly, even after, 8, 9, 10 years of doing this, I don't know how long it's been now, I still kind of sit there in awe because it amazes me every time. Every one of those people, all 5 of them, had an increased inflammatory markers. And I can go to specific markers. They were C-reactive protein, fibrinogen, sedimentation rate. Every single one of them had them on the high end, right? Before the IV laser. And at least 3 of them had increased liver enzymes, and 2 had very, very high cholesterol, but not the good kind. And I was actually very impressed because at the end of the 5 days, on day number 6, we repeated the same labs. All inflammatory markers went down to normal range, and the 3 patients that had the increased liver enzymes went down into normal range. We retested in day 15, and they still held with the same result. Now, they were eating a fairly healthy diet, but they really didn't change too much of what they were doing. These are people working in the healthcare industry, but not specifically dealing with anything, right? So that was we did not see any negative side effect. Even white blood cell counts improved, hemoglobin levels improved. We only saw, and this is just clinical data, apart from, subjective, they noted feeling more energy, they slept better, they had improved flexibility in their muscle fibers. They didn't feel as tired in the morning when they got up. They didn't have to have that boost of coffee. They just did it because they liked it. Those kind of things. So I that was kind of a little bit of a long answer, but I want to give you actual data as well. We have not seen a negative side effect. The only thing, obviously, is you don't put the laser straight in your eye and stare at it. Mm-hmm. Other than that, we have not seen it. I'm impressed also with Lyme disease. One of the biggest issues we have with Lyme is the Herx reactions from many treatments we receive. And we've worked with some of the, leading experts in Lyme disease and integrating photodynamic therapy into their practice with what they do. And they can even reduce the dosing of what they're using because the laser is potentializing or potentiating the effect. And yellow laser enhances serotonin and dopamine in the body. It also enhances vitamin D absorption. One of the biggest issues with many Lyme patients is they either cannot take vitamin D. Many of us know why they can't absorb it. Or even in cancer, we're chronically low. None of us go out in the sun. So we have noticed an improvement by just applying the intravenous yellow laser in those markers. And when we Herx, we will put the patient on IV yellow laser. We have found that it opens the detox pathways and can cut out the Herx reaction for people. And I'm sorry, but that's amazing because I have not seen that. Lyme patients get, especially when they're that sick, I understand that firsthand. A lot of times there's not much you can do to calm that down, especially when you're in a reaction or a flood from medication or treatments, whether it's natural or pharmaceutical. And that's one thing that really does improve the effect of that side. That's it, that issue.
I could say we've seen that at our center because, we have a large population of Lyme disease patients here in the Northeast and from around the world. Really, Lyme isn't a localized, disease anymore. And one of the hardest parts is always the detoxification. And then when you go through antimicrobials, that's when you have this kill off, this die off, and to minimize that as much as possible through the use of, combining the IVs with the laser at the same time, using the yellow and all those others to really minimize. And it's been a really great adjunct therapy to all those IVs that, patients are going to have to go through and really, make it a much easier process to get rid of Borrelia and all co-infections in the body. So, and it's great to hear that, of course, there are no dangers or really true side effects that you see with so many other therapies, conventionally based, at least.
Yes.
So that's really wonderful to hear. Now, Dr. Weber, we're talking about these adjunct therapies and complementary therapies. You mentioned UVB earlier. We've utilized UVB also, and you've done a great job implementing it. But are there other combination therapies you've seen with the endo laser IV application that have really worked together well, whether that be other oxidative, whether ozone, H2O2, hydrogen peroxide? Are there other ones you're seeing, or really is this an application where you can go along with anything and just kind of enhance that, even if it is some other type of IV or even a type of energy medicine therapy?
Yeah, first of all, the intravenous laser is a typical combination therapy. Yeah, when you look at the effects, what I told you already, opening circulation and improving metabolism on the cellular level, improving oxygen supply, everything what you are doing, you give patients medication, yeah, medicine, maybe for high blood pressure. You give them maybe infusions to make them stronger, to stimulate the immune system, you know, like vitamin C or other vitamin cocktails or anything, you know. Or maybe you want to detox the patients, yeah. Maybe you want to bring the heavy metals out, you need maybe chelation or something. Everything what you are doing on your patient works better if you combine with intravenous laser, because intravenous laser make the conditions in the body, what I told you already, so in a way that everything can work better. So we have seen, for example, you have a patient taking 2 or 3 different medications for high blood pressure. Yeah, many take beta blockers and ACE inhibitors and vasodilatation drugs and everything, and they don't like it. Yeah, many patients look at the 60, 70-year-old patient coming from the doctor, have the handful of 20 pills in the morning and swallow them, you know, high blood pressure, diabetes, for heart, for blood flow, for cholesterol and everything, you know. They don't like it, of course, no? But you can reduce all this medication, yeah? Especially if you speak about diabetes, is one of the biggest issue, you know? And diabetes is mostly connected with other problems. We call it metabolic disease, yeah? So diabetes is very often combined with overweight, with high blood pressure, so many different heart disease, you know, and maybe brain problems already. So you can really reduce all this medication. They work a lot better. Some people can reduce from 10 tablets maybe to 1 or 2. Yeah. The chelation, the detoxification works a lot better because the liver function is improved. We just heard from Jennifer, and we also have seen this. If you have a fatty liver, you know, many people have a fatty liver, diabetics or people overweight, the liver function is not good. And we see already the enhancement, you know, of the liver values. This is going down because we stimulate and improve the liver metabolism. And the liver is the most important organ to detoxify. And beside, of course, the kidneys, you know, and can go out through liver or kidneys. And we have seen just in the beginning that the creatinine, you know, the creatinine is the value for kidney function, is going down. So the kidney function is improved a lot. No? On the same step, we increase the heart function, of course. Yeah. So if you have people, you know, already with the heart dysfunction, cardiomyopathy, something, what you can measure in echo on different laboratory results, after 10 treatments, you can see a dramatic improvement of this. No? So I think if I want to answer your question, in general, everything what somebody is doing on the body is improved by additional intravenous laser.
Interesting. And this is a follow-up question from someone actually at our clinic, one of the medical team here, that if you were to use ultraviolet blood irradiation therapy along with a different, can you utilize that together? Because we know there's the UV application itself that is already intravenous, which sort of subsedes that. But in some patients, there has been some noticing, even through bioenergetically testing, that combining the external UVB along with a different color light was seen as beneficial for the patient. Have you ever seen that before?
Yeah, first of all, please don't speak about UVB. No? You know, we have different kinds of UV light. You know, we have the strong UVC between 200 and maybe 280 nanometers, which is dangerous. We use it for sterilizing, you know. Then we have the UVB between 280 and 320. And this is the one who can make cancer on the body. We know this. And we have the UVA for between 320 and 400 nanometers because becoming visible light, blue and green and everything. So we are only using UVA light because this is absolutely harmless. And if we speak about, and we use, of course, UVA light for cleaning the body from bacteria and viruses. And in this moment, I come back to the photodynamic therapy. So I told you in the beginning, we can use different light sensitive substance which bind to cancer cells, make them light sensitive. You irradiate them with the right light according to their absorption spectrum, produce oxygen radicals and kill them. But we have also an antiviral or antibacterial therapy. So when I use ultraviolet light, UVA light, especially in cases like Lyme disease or other chronic viral infection, Epstein-Barr and all these different things, I always use it as a photodynamic therapy. And the best photosensitizers, we have different natural photosensitizers, which work excellent. We can add riboflavin, vitamin B2. And now we have the studies, vitamin B2 with UVA light and blue kills all the COVID virus within minutes, We can use curcumin. Everybody knows curcuma, and also binds to microorganisms we stimulate with the blue light, And then we have water-soluble chlorophyll, chlorophyllene we call it, works with red light. So all these microorganism problems, what we all have inside our body anyway, and especially the chronic patients, this is the main field of UV light for me. And of course, additionally, it stimulates the immune system as well.
Of course. And thank you for clarifying. It's my way of abbreviating UBI. Most people say, I say UVB, not literally meaning the B class, because I understand that. And I understand the confusion when I say it. It's easier for me somehow to say UVB rolls off the tongue better than ultraviolet blood irradiation therapy or UBI. So, but thank you for clarifying, because it is important, of course, the type of UV light we're utilizing to try and kill pathogenics, infections, especially in the bloodstream. So, Jennifer, really quickly, what have you seen in your clinic as far as, because Dr. Weber did a great job illustrating how diverse this is, but are you seeing that the Weber laser and especially an intravenous application is more geared towards certain conditions, or is this really kind of anyone can benefit from this?
Very good question. I will be honest in saying that we haven't really seen a condition that it doesn't assist with yet, to be honest. But that does not mean that there are certain conditions that we have more research and have had more applications with that we see a greater response so far. So meaning when I say that, I mean, we've had so many people that come through the door, and many physicians ask me, well, what can you use it with? And I usually say, well, honestly, there's not a lot that you cannot utilize it with, because it's only going to benefit. It's light, right? It's kind of like light is life, as Dr. Weber said. Mm-hmm. But having said that, there are certain conditions and ailments or diseases or issues that we've had quite a bit of experience treating and seeing great results, because we've had more experience there. We have more protocols designed. There's still areas that, we don't even know. I was on my way to Florida to see Dr. Weber years ago for a conference. I got the blood clot in my leg. My partner said, why don't you use the laser watch on it and see if it clears the clot? Makes sense. Red light, circulatory assistance, reducing inflammatory response, right? So that's a good idea. Put it on topically, and lo and behold, 3 days, using it every day for about 2.5 hours, just sitting there with my leg up while I was working. It cleared a blood clot and improved blood flow by 80%, confirmed by Doppler ultrasound. And that was something we didn't know. We then started utilizing it in our clinic with Lyme patients and also cancer oncological patients who had one in specific that was really amazing. Was she had a blocked artery, a blocked jugular. She was scheduled for a procedure, an angiotac procedure, to do the wire, right, when they pull the clot out with the dye. But we did 5 days with her of intravenous red light and topical applications. And when she went in for the procedure, did the test to locate the clot, and it was gone. And we have the images to back this up. So showing that it works in vascular issues was amazing. Looking at COVID, Lyme disease, viruses, we've had so many different patients come through the door with, end-stage kidney failure, and we're able to turn them around. We have one of the most impressive things I see was a pancreatic cancer patient who came through the door that we worked with doing the interstitial application with this amazing photosensitizer that Dr. Weber and one of his colleagues, I'll say my colleague as well, but specifically Dr. Weber's colleague, a brilliant scientist, created something, and maybe Dr. Weber can share a bit about this, called nano-ICG, indocyanine in green. It's a substance that's been around for many years, but they created a nanoparticle form, which activates specifically with infrared light. And we utilize that, of course, in combination with other cancer therapies, but we integrated them to have a synergistic effect. And we injected this nano-ICG directly to and around the tumor area in the pancreas, along with this infrared light directly guided by ultrasound. And of course, we're doing protocols that Dr. Weber can do in Germany because of where our clinic's located as well, right? So we're working with Dr. Weber very closely on those protocols and integrating them. And we saw that tumor turned completely necrotic in about 3 weeks' time. It was amazing. Her CA19-9, which is the marker for pancreatic cancer, dropped from 4,900 to 200 and something at the time. And it was a response I'd never seen before. So there really aren't limits to this, to be honest, but I don't want to sound like, oh, it's magic, it works for everything either. We know that there's limitations, but I have to be honest, it's the one therapy I think that really has the ability to kind of cross thresholds, per se, because we have many physicians that we work with as well. And even in our own clinic, we were using high doses of curcumin and high doses of, just that one thing, for example. And rather than giving 500 milligrams of curcumin, we can give 50 when partnering it with photodynamic therapy and have the same effect, easier on the patient and a much better absorption. So sometimes the microdosing in combination with PDT, photodynamic therapy, or IV laser is much more effective than what we're doing. I think in some cases we're almost over-treating the body and the body can't handle most of that. And what the photodynamic therapy or laser therapy does is it helps enhance our bodies to absorb it, to utilize it. It gives our body the energy. So I hope that answered your question, Casper. And Dr. Weber, I don't know what you think about that answer, but that's, again, I would say that we have experiences in many areas, especially chronic infection, oncology, but there's still more to research. And that's what's so exciting about this field. There's always something new.
There's always something new. And I think that's the beauty of medicine and dynamic stages of where we are in medicine, is that we are. And that kind of leads to that point of, the science being settled. The science is just getting started, especially on something like this. We are not yet settled here. We are only getting started. And I know, Dr. Weber, you have some great research in how photodynamic cancer therapy works. And you also have something really exciting. And you just recently published a study on the treatment of COVID-19 with photodynamic therapy. So that is a big one right now. And I want to jump into that and leave us a little bit of time here to discuss that, because there's no bigger topic in the world right now than that C word, the COVID. So tell us a little bit about that research and kind of basically what you found utilizing IV laser therapy, photodynamic therapy for COVID-19.
I think this developed from our long years knowledge about photodynamic therapy. So, we are working with lasers for 20 years, most for pain management, acupuncture and everything, intravenous laser. This is something what we use for regeneration of the tissue, Lasers have two different effects, so that somebody who has no knowledge has to know lasers regenerate the tissue, but with the same lasers, I can destroy tissue. Like a surgical laser, but for destruction, I need a light-sensitive substance which binds to a bad cell, cancer, maybe microorganism, stimulated by light, and then we get oxygen radicals and it is destroyed. So this is the basis of photodynamic therapy. And we have a long experience with this. We know all the different photosensitizers. We have experience with this curcuma, with riboflavin, which is vitamin B2, methylene blue, and chlorophyllene and all the things. So we know how it's working. And when this virus came, all over the world, We thought about it. No? Why not do it with photodynamic therapy? Because the so-called antimicrobial photodynamic therapy, not anti-cancer, antimicrobial, has already a long history. And there are many studies for years showing that especially riboflavin is nothing else than vitamin B2, which is cheap, you know, can bind especially to viruses and to a complex, you know, and once you irradiate it with UVA and blue light, it is destroyed within minutes, you know, and especially, you know, for long years already, we give to the blood bags, you know, what we give to the patient in the hospital, we add riboflavin. And there's a small machine, the name is Mirasol system from Teruno company in America, put this blood bag with riboflavin 5 minutes in the machine and all viruses die, all. Hepatitis, HIV, everything dies. And this experiment was also done with riboflavin in April 2020. I said, okay, it's working, we know this. Why we do not set up a system for this? It's not difficult. So I thought about it and then I said, okay, first of all, I wanted to make something what people can do at home, not running. We have thousands of patients that cannot go all to the doctors, and we want to treat them in early stages before the infection goes down in the body or in the lung. And yeah, I designed a nose adapter. You know, it goes through nose and mouth first, with blue and ultraviolet light. And I designed a mouth adapter with the 24 diodes, ultraviolet and blue light, you know. We can give riboflavin as a capsule. It's well absorbed in the body. You'll see later on your yellow-green urine. And then it's in the bloodstream. And we can also dissolve in water and spray in mouth and nose, let it work 15 minutes, and then treat with this system. And we use this, what Jenny spoke about it, the laser watch, you know. The laser watch is like a non-invasive blood irradiation, because we know today the virus also go in the blood. They attack the heart, the liver, the kidneys, and even the brain. This is all well known now from the last month. So we can treat the bloodstream, the artery, with the laser watch. We can spray in mouth and nose and make the treatment. So I said, okay, we have to make a study for this. No? And I tried to set up a study in Germany, but in this time, it was September, October last year, the hospitals, we had not many patients at this time. And in all the big hospitals, the drug companies are and make their studies, pay billions of millions of money, you know. I had no access to patients, but I have a long friendship to many doctors in Iran. Years ago, we made heart studies in the university in Tehran. And at that time, they had 1,000 dead people every day in one city. It was full. The hospitals were full. They sent the patients down home for dying, you know. So I went there myself. It was a life-threatening event. I was sitting in a small room with 10 patients without mask coughing at me, you know. And the doctor said, oh, we got it, you get it as well. I said, no, I will not get it. I make my own treatment every evening in the hotel, you know. And then I treated this patient. They were so sick, you know. It was, I think it was the most amazing experience in my life, because I made it myself. And when the patients came back 2-3 days later, they were happy, they were healthy in this moment. And 90% of the patients had a negative test, you know, after 5 days. We couldn't even believe it. And the laboratory called us, you made something wrong. They couldn't believe it. So we had 20 patients and 20 in a control group without treatment, only testing every day, no change. Some people even died and had to go in an intensive care unit. So we had 40 patients. I published this data, and now we have another 100 patients ready since 1 week, and the results are the same. And now I put everything together, and I want to publish maybe in Lancet, so in Science or Nature, so in a big journal. This is the short history. I experienced this myself, and I have seen how it's working, you know. And we have many colleagues and doctors and friends calling me, oh, you have a new system, I'm positive, my family is positive. We send the box there, they treat it, 2 days is gone. That's photodynamic therapy for virus. I went there because I knew that it's working. You remember that President Trump said, oh, if we can bring the UV light in the body, yeah, then we can kill the virus. He had no knowledge, of course. No? The UV light cannot do anything alone. You need a photosensitizer, you know, and that's the key. This is photodynamic therapy. You know, 9 years ago, my son Robert with his partner, they made a study in the bad cases of malaria in Nigeria. That was never published. 90% cured after one treatment course in 5 days. We know that it's working. So I'm sure we can remove all these bad infections. And, you know, now we believe on the vaccination, but we see every day the virus is mutating all the time. And maybe we'll come to a point where the vaccination is not completely working. So, and the vaccination is no therapy, but this is a therapy. Easy, cheap, and everybody can do at home. In more severe case, maybe he goes to the doctor and he make intravenous riboflavin and maybe intravenous laser. But if you're just positive and you have no signs of infection, people can do at home. I think it will be a great contribution. That's the short story about this. And I think we could solve this problem. Everybody would use it. Nobody has to go in a hospital or nobody has to die on it. I know, and this makes me sad because I see every day 30,000 infections, 500 people die. I know exactly it's not really necessary. Hopefully, I get the therapy more in the world after the next publication. So that's the short story. Yeah.
Number one, amazing short story. That was captivating, and going to Iran and being around these people and seeing the results you saw and doing all that. So incredible, and congratulations for going through all that and finding all this. Number two, are you worried at all that these types of findings don't want to be found? You have incredible, I mean, listen, here in the United States, of course, Big Pharma runs things. They don't want anything outside to disrupt what they're doing. Right now, over a year has passed, no one has spoken about anything aside from stay home, wait, wear your mask, and wait for the vaccine. Don't worry about any kind of, whether it's ivermectin or anything, and basically wait. So something like this, that's really simple. Like you said, you could do this at home. You don't even need the doctor. I mean, it's astonishing and amazing. But to me, it almost frightens me for your own sake. But are you worried, or do you think this will be accepted well? What are your thoughts? Because you have this study ready.
I'm sure this will be accepted. Now we have 140 patients already. And if it's really published in a famous journal, what everybody reads, you know, the journalists from the newspapers and everything, it will quickly go around the world. And I know it's working. And, you know, especially because the problem, what we have everywhere and what we see here in Germany are all these terrible mutations, and the people say, the companies say, okay, we make an update of the vaccination. I'll give you one example. We have a vaccination against influenza, you know, for 20 years, you know, and we have big vaccination every year. 3 years ago, in the winter 17-18, 25,000 people died from flu, 650,000 people in Europe, although we have a vaccination. The vaccination is made in springtime for the next winter, but in this time the virus is already mutated. And the efficacy of the influenza vaccination, you can read everywhere in the internet, was 15%. And the years before 20%. And maybe we are running in the same situation. You know, we need something as a therapy. The vaccination is a prevention, what is good and necessary, but will get its limitation. This virus is so intelligent, you know, and the problem also, the more we vaccinate, we give a pushing on the virus to select the more resistant ones. Look, we gave millions of antibiotics all the years, with the result that it's resistant now, you know. Think at the resistant stuff, look, MRSA and all these antibiotics. So maybe we go in the same direction. So we need a therapy on the side, and something what is not expensive, what you said, what everybody can do at home, what the whole family can do, you know. And this is the idea behind it. I know the industry, they try to make also therapies, medication, immune drugs and everything. Of course, this will cost $1,000 or so. They want to make money, of course. No? I think the pharmaceutical industry are not interested in our therapy because they cannot make the big money, you know, that's the problem, no? But everybody needs money. Also, we need it, of course, for research. But the main issue that I'm doing is to prevent all this terrible suffering of the people, you know, in hospitals, getting on the machines and have the later complications and see them dying. What I think is not necessary if we can distribute this new therapy.
Absolutely. And it's a simple therapy. It's utilizing something that is in nature already, just light in the right way and done in a very scientific manner and actually getting results as you've shown in your own research. So I really hope that people pick up on this, and I'll definitely be telling every doctor I know about it as well and pushing it out. So congrats on that. Jennifer, you know, Dr. Weber did a great job of talking about the endo laser, this new application through there. And he mentioned the watch, of course, and you mentioned that earlier. And I know there are other applications as well and other products that were developed that you guys now distribute and utilize also in therapy. Can you go over some of those, and including the watch? I know there's a helmet, there's other things. And can you go over those and just present those?
Sure, and I wanted to add something to what Dr. Weber was sharing on the viral studies as well. We've actually done, he was mentioning the malaria study, which was impressive. And also we've done studies on Epstein-Barr, HIV, cytomegalovirus, and every one of them have gone negative test results after doing these studies. So it backs up what he's talking about, the COVID, right? And since it is continuing to mutate and change, we even had some very close colleagues of ourselves here that utilize the kit as well. And we have a study that we're trying to get going also for the government in Mexico to show this as well, because there are, as Dr. Weber said, there's too many people that are suffering from it. And there's too many options available like this. So bridging that, many people know of the endo laser system, which is the larger laser system that Dr. Weber created. And the larger system is used both for intravenous, topical, transcranial application, as well as interstitial. Can be utilized for both intratumoral or joints. So many clinics are utilizing that for regenerative medicine or chronic joint inflammation, or repair after a chronic immune problem, sports injuries. So it's an endo laser system with multiple forms of application, which is honestly very exciting, because you can design the system to create, as you know, Casper, as well, to create it what you need in your own clinic. And you can also add on to the system as well. And I'll do a quick note on that. When we first started working with Dr. Weber and the team, they did not have the ultraviolet nor the yellow diode created as yet. And rather than buying a whole new system, we were able to purchase and add on the diodes to the already existing system, which is something I have to say, working with Dr. Weber very closely, professionally as well as friendship, I really admire him and Robert Weber and their team for doing that, because many clinics get stuck with a system and then have to get a whole new system a year later when there's an update. He's made sure that people can actually continue growing with them. So that's one thing. The other are the home care devices or in-clinic devices. So there's the laser watch. Dr. Weber originally, as I can see him smiling there, started with just the red light laser watch, and it developed into now something called the Spectra, which has red, yellow, green, and blue. It comes with a nasal applicator for intranasal laser therapy, ear applicator, which we've seen great results with tinnitus, by the way, and a little pad that connects to the laser watch. And the laser watch, even though we say watch, it's not actually a watch. It's utilized on the wrist. So that's why we say a watch, but it can be utilized in many different forms. It's great for jet lag, high blood pressure, fatigue, inflammation. I mean, pain. We've had people utilize it with chronic pain. I can go on and on this one. He's developed an infrared helmet, which is used for transcranial applications, with a frequency box, so you can choose specific frequencies that can be put in with the infrared light. And the benefit of that is to changing, alpha, beta, depending on the brainwave pattern. But this is actually, there have been extensive studies done on utilizing this with Alzheimer's, transcranial issues with neural Lyme disease, Parkinson's. We've seen people utilize it, traumatic brain injury after stroke, ischemic issues. And infrared can penetrate much deeper. And Dr. Weber can probably share a little bit of why he created and how he created that helmet. And then he's also created, obviously, the new kit. And the new kit is basically the laser watch, but with the ultraviolet and blue attachments for oral and for nasal. And even though it was created with the idea of working on COVID, we've had many Lyme or chronic infection patients utilize it as well, just for overall immune system issues as well, fighting viruses, fungus, all those other types of things. And these can be both items that can be taken home or utilized in a clinic facility, which is nice on in-betweens. He also created a wonderful infrared pad. He also has this amazing light bed, which is this huge, long light system that goes, it used to be look kind of like a tanning booth. Now it sits over a bed that can be utilized in a clinical facility as well. That is quite impressive. And he can probably share on that as well. So the one thing you'll learn about Dr. Weber is there's always something new. Every time I talk to him, whether it's a week later, a day later, or 6 months later, we're always sharing something new.
Well, that was going to be my next question for Dr. Weber. What's next? And it sounds like you're the Thomas Edison of lasers here, and you're just inventing things left and right. And so what is next do you see more products coming out? Are you hoping to focus on research, or what are you looking at?
All the above.
You know, the secret of the permanent improvement, or bringing out new things. We have a company, of course, we are manufacturing this, and of course, if you have a company, you manufacture a device, you want to sell it, but the problem is how to get this device and everything in clinical applications. And, as a manufacturer, I don't know even what the patients need, how it's working on patients. Maybe I have to give it to a hospital or university, pay a lot of money and let them make the studies. But everything what we develop is developed in our own patients, in our own clinic, When I have something new, I can give it to my patients. I have all the time clinic full with chronic diseases, with cancer patients, and I can give them, of course, we are not making experiments, we don't give things where we maybe can expect side effects. So we give them and we can see, goes this in the right direction. So from our patients' treatment, and we learned on our patients, we could get more and more improvements. I'll give you an example. You want to treat cancer patients. The cancer is maybe metastasized all over the body, spreading everywhere. And of course, when it's a single cancer, single node in the breast, for example, it's not difficult. You give photosensitizer, you can treat it on this node, quite externally, maybe interstitially, and it's working. But what is when patients have spreading cancer all over the body? So how we can treat the whole body? This is the reason that we developed this light bed, with 10,000 diodes, the patient lies inside, and it's irradiated from the backside and from the front side through the whole body. This was a great breakthrough. Another thing is what we right now developed, the biggest issue of, for example, successful cancer treatment is the hypoxia of the cancer cells. So, and if we have no oxygen in the cancer, it will not work because we need oxygen radicals. So, of course, we put now the patient in a hyperbaric chamber for this, which is anyway good for the body. But we developed a new product. This is a mixture from hyaluronic acid with hydrogen peroxide, which we can inject in a tumor and delivers for 24 hours oxygen, so that it's a great improvement of the therapy. What I want to say with this, we learned many, many years on our patients. We see the results, then we can see how we can make it better. And this is the reason. And when you ask me, what's coming next? That's a good question. I think, we spoke already a little bit about anti-aging, intravenous laser, but we not spoke about it, that the main effect, from my opinion, beside all these wonderful effects, what we discussed already, is the stimulation of our own stem cells, you know. All the time, every day, we bring our own stem cells from the bone marrow in the blood circulation, and they will not do anything. But when they get energy, you know, they will focus and target on organs where there's chronic inflammation and chronic degeneration with laser light and stimulating their mitochondria. So when we see that a patient with cardiomyopathy improves a lot, you know, in the echocardiography, or we measure pro-BNP, you know, brain natriuretic peptide, which is a marker for heart failure, you know, and we can measure that this is going down 50%. How can this be? We give a little bit photons in the blood and the heart getting better. No? It's not such simple that the photon go with the blood to the heart and improve it. No, I think this long-lasting effect is the stimulation of our own stem cells. And when we speak about anti-aging, and that's what we are doing now, we have a new method for generating our own stem cells from the adipose tissue. Yeah, we have 1,000 times more stem cells. We have a new procedure using ultrasound to get them free from the fatty tissue. We infuse them or inject them in joints and stimulate them with our lasers, and we're getting great results. So that's the future. Another option is if we put a needle intravenously, we stimulate the blood system. We can also put the same needle, very similar, in the bone marrow, yeah, in the tibia head, for example. And we have the studies from Israel, a lot that when you stimulate the blood, the bone marrow with infrared laser, for example, billions of stem cells will come free and target immediately on all these processes. So that's the next step, is bone marrow treatment with lasers, stimulation of the stem cells after this treatment to get them alive and everything. And I think this is one of the biggest option for the future to get more life, longer life, and better quality to the patient. So that's the next step in this history.
Truly fascinating. And I love that anti-aging application and living longer, because I feel like we're going to need you for the next 100 or so years to keep coming up with new inventions, to keep going.
The studies. They made already studies in Korea, you know, some years ago in mice, you know, gave them stem cells and putting the intravenous laser through the tail in the mice, you know. And then they compared the life expectation of this group with another one without this treatment. And they have seen that the lifetime is about 30% longer, you know. And I know that the big drug companies, you know, they expect already $1 trillion business for the future. And some people say, especially in America, the FDA made the regulation so strong now that they said you produce a medicine and then you have to make a lot of requirements. People cannot afford this, so that most of the stem cell clinic had to close in the US and go to Mexico or Bahamas or so. They think there's this regulation, and in Europe it's the same thing. We took them from the FDA and all the stem cells closed, you know. But the new modality, what we are doing with ultrasound, this is accordant with the regulation, and from the German government, the Paul-Ehrlich Institute, to also regulate now all this vaccination, we got an official approval already of them. So that's my great hope for the future.
I love it. You're finding loopholes to help us live to 150 or longer. That's great. And I truly believe we can. We can. I mean, we've been inundated with toxins, with all these things that are kind of reducing our lifetime expectancy.
I'm sure we can. We can
reverse that. Absolutely. So I love what you're doing. Jennifer, where can people learn more about your practice, purchase these at-home laser device or the endo laser? Give the audience a scoop of where they could go to learn more, purchase, take action.
Well, there are websites set up in Germany as well as the United States. We're all one big team, so we're here to support and answer questions. The one thing I want to throw out there is that we are working on finalizing the nonprofit in the United States as well as the one that's in Germany. And the nonprofit here in the US will be focused exactly on that research education. So anyone who's interested in trying to be part of more a team of researchers, which is why I love working with Dr. Weber. It's not just about business, it really is about research and trying to help people. And that's what we are about. So as far as more information, there is the wmedicalsystems.com. And then there's also weberlaser.com and weberlaser.info. For ordering within United States or North America, it's usually the weberlaser.com site. And then there's more information on both weberlaser.info and wmedicalsystems.com, as well as webermedical.com. So there's different sites with different information. There's a YouTube channel. I highly suggest looking Weber Medical on YouTube. You will find Dr. Weber giving a ton of presentations. You can email us as well, call us, ask questions. We're here to share and share our experiences. So that's why we're doing what we do, because we love it.
Amazing. And there really is a lot of information out there. We're going to have the links up on our posts here that go along with this podcast, so you could check that out. I know our whole team here at NYCIM has felt like they've become very friendly with you watching all your videos, Dr. Weber. So great job on that. That they are wonderfully informing, and they are empowering in a sense, because we've even shared that with patients as well. And they start to understand it. When you understand how something works, you buy into it more, you release that skepticism, you just allow it to occur without any sort of challenges or blocks there. So listen, guys, great job to both of you for what you're doing and pushing the boundaries of medicine. And I'm really happy to be involved with all this and then be applying it in our clinic and helping others as well. So thank you for being on the show. Continued good luck and success in everything you do. And I hope to have you guys on soon when you create the next big thing and really, continue to change the world.
Thank you.
Okay.
We appreciate it.
Thank you very much. Thank you. It was a great pleasure.